NLN NEX learning modules. Question 1. Which sum equals 7/15 plus 7/15 in this data table item? Option A 0. Option B 14/15. Option C 7/15. Option D 49/15. The correct answer is option. The denominators are already the same, so add the numerators. 7 plus 7 equals 14, then simplify to 14/15. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 2. During a quick NEX review of a algebra review item, which word is closest in meaning to impartial in a classroom review sentence? Option A, fair. Option B, fragile. Option C, biased. Option D, distant. The correct answer is option. Impartial means fair, so that choice matches the meaning in context. Fragile means easily broken, not fair. Biased means unfairly one-sided, not fair. And distant means far, not fair. Question 3. After checking the choices in a heart rhythm item, which answer identifies the process moves water across a semi-permeable membrane? Option A, mitosis. Option B, exocytosis. Option C, osmosis. Option D, a transcription. The correct answer is option. Osmosis is the diffusion of water through a selectively permeable membrane. Mitosis is cell division, exocytosis moves materials out of a cell, and transcription copies DNA information into RNA. Question 4. If a lung function stem gives one clear clue, which answer best explains the author's point? A school added quiet study rooms, and students reported fewer distractions. Option A, students no longer needed to study. Option B, reducing distractions can improve study conditions. Option C, quiet rooms increase noise. Option D, distractions are always helpful. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Students no longer needed to study is not supported by the passage, quiet rooms increase noise is not supported by the passage, and distractions are always helpful is not supported by the passage. Question 5. When time is limited on a digestive process question, which critical thinking response best fits this situation? A graph rises sharply after a policy change, but no other information is given. Option A. The policy must be ignored. Option B. The graph shows a possible association but does not prove causation by itself. Option C. A rising graph proves the policy caused everything. Option D. Graphs cannot show patterns. The correct answer is option. A time pattern can suggest a relationship, but causation requires stronger evidence. The policy must be ignored does not follow from the situation. A rising graph proves the policy caused everything does not follow from the situation, and graphs cannot show patterns does not follow from the situation. Question 6. Given the information in a homeostasis item, which dose volume gives 375 mg from a supply of 125 mg per 2 ml? Option A 12 ml. Option B 0.33 ml. Option C 3 ml. Option D 6 ml. The correct answer is option. Set up the proportion 125 mg, 2 ml equals 375 mg x ml, so x equals 375 times 2, divided by 125 equals 6 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 7. Suppose a similar scientific method item appears on test day. Which word is closest in meaning to monitor in a classroom review sentence? Option A, observe. Option B, paint. Option C, debate. Option D, neglect. The correct answer is option. Monitor means observe, so that choice matches the meaning in context. Paint means apply color, not observe. Debate means argue, not observe. And neglect means fail to care for, not observe. Question 8. While working through a timed control group set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A, bronchi. Option B, nephrons. Option C, alveoli. Option D, villi. The correct answer is option. Alveoli provide thin, moist surfaces where gases diffuse between air and blood. Bronchi carry air toward the lungs, nephrons filter blood in kidneys, and villi absorb nutrients in the intestine. Question 9. Before choosing an answer in a sample size item, which answer best explains the author's point? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. Hand hygiene cannot affect infection. Option B. The refresher removed all risk permanently. Option C. A training increased infection rates. Option D. A training may have improved compliance with hygiene practices. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection is not supported by the passage. The refresher removed all risk permanently is not supported by the passage, and training increased infection rates is not supported by the passage. Question 10. A student sees this enzyme activity idea on a NEX review, which increase is shown from Monday 19 to Wednesday 29 in a simple practice chart. Option A, 48. Option B, 10. Option C, 29. Option D is 7. The correct answer is option. The increase is the final value minus the starting value, 2919 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 11. 1 pH scale practice problem tests this skill, which average results from scores of 60, 64, and 68. Option A, 192. Option B, 62. Option C, 64. Option D, 8. The correct answer is option. Add the three scores to get 192, then divide by 3 to get 64. The other choices use the sum, the range, only two scores, or an added value rather than the mean. Question 12. Several choices look tempting in a solution chemistry item. Which word is closest in meaning to predict in a classroom review sentence? Option A, remember. Option B, borrow. Option C, repair. Option D, forecast. The correct answer is option. Predict means forecast, so that choice matches the meaning in context. Remember means recall the past, not forecast. Borrow means take temporarily, not forecast. And repair means fix, not forecast. Question 13. For this genetics clue nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A, platelet. Option B, antibody. Option C, hormone. Option D, enzyme. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Platelet helps clotting, antibody targets antigens, and enzyme speeds chemical reactions. Question 14. In a short cell division practice STEM, which answer best explains the author's point? A clinic sends appointment reminders, and missed visits decline. Option A, patients cannot benefit from reminders. Option B, reminders can help patients remember appointments. Option C, appointments no longer need scheduling. Option D, reminders caused more missed visits. The correct answer is option. The decline in missed visits supports the role of reminders. Patients cannot benefit from reminders is not supported by the passage. Appointments no longer need scheduling is not supported by the passage, and reminders caused more missed visits is not supported by the passage. Question 15. Among the choices in a bone support item, which answer identifies the transfer of heat through direct contact? Option A, radiation. Option B, conduction. Option C, evaporation. Option D, convection. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, evaporation is liquid changing to gas, and convection moves heat through fluid circulation. Question 16. Using the facts in a muscle movement question, which for flow rate delivers 0.5 L over 2 hours using a 10 GTT/ml set? Option A, 42 GTT/min. Option B, 4 GTT/min. Option C, 2500 GTT/min. Option D, 250 GTT/min. The correct answer is option. Convert 0.5 L to 500 ml, then use 500 times 10 divided by 2 times 60 to get about 42 GTT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 17. Based on the clue in a nerve signal item, which word is closest in meaning to relevant in a classroom review sentence? Option A, unrelated. Option B, heavy. Option C, ancient. Option D, related. The correct answer is option. Relevant means related, so that choice matches the meaning in context. Unrelated means not connected, not related. Heavy means weighty, not related. And ancient means very old, not related. Question 18. Consider this high-yield endocrine message concept. Which answer identifies the cell division that produces gametes? Option A, meiosis. Option B, translation. Option C, mitosis. Option D, diffusion. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Translation builds proteins, mitosis produces identical body cells, and diffusion moves particles down a gradient. Question 19. Near the end of a glucose regulation review session, which answer best explains the author's point? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, timed practice can build exam familiarity. Option B, the exam has no time pressure. Option C, timed sets remove all content gaps. Option D, comfort never changes with practice. The correct answer is option. The passage connects timed practice with increased comfort. The exam has no time pressure is not supported by the passage, timed sets remove all content gaps is not supported by the passage, and comfort never changes with practice is not supported by the passage. Question 20. Across similar chart reading nursing entrance questions, which critical thinking response best fits this situation? A patient says, I feel better, so I stopped the medication early, in a health literacy passage. Option A, teaching is unrelated to medication use. Option B, a medication should always be stopped early. Option C, the statement shows a need for clearer teaching about completing treatment. Option D, the patient fully understood the instructions. The correct answer is option. Stopping early can be unsafe depending on the medication and condition, so teaching is needed. Teaching is unrelated to medication use does not follow from the situation. Medication should always be stopped early does not follow from the situation, and the patient fully understood the instructions does not follow from the situation. Question 21. Since only one choice fits the ratio setup clue, which value of x solves 5x plus 12 equals 52? Option A, 40. Option B, 8. Option C, 7. Option D, 9. The correct answer is option. Subtract 12 from both sides to get 5x equals 40, then divide by 5 to find x equals 8. The other choices result from stopping after subtraction, adding one too many, or not reversing the operations in the equation. Question 22. From the information in a unit conversion item, which word is closest in meaning to sequence in a classroom review sentence? Option A, order. Option B, weight. Option C, texture. Option D, chaos. The correct answer is option. Sequence means order, so that choice matches the meaning in context. Weight means heaviness, not order. Texture means surface feel, not order. And chaos means disorder, not order. Question 23. At a testing desk during a percentage item review, which answer identifies the solution with pH above 7? Option A, neutral. Option B, acidic. Option C, hypotonic. Option D, basic. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Neutral describes pH 7, acidic describes pH below 7, and hypotonic describes lower solute concentration. Question 24. Inside a fraction item science or skills item, which choice most accurately summarizes the passage? A patient education sheet used short sentences, headings, and pictures. Option A, headings reduce the value of information. Option B, pictures make written instructions unnecessary. Option C, clear formatting helps readers understand health information. Option D, long paragraphs are best for patient teaching. The correct answer is option. The sheet is designed to improve readability and comprehension. Headings reduce the value of information is not supported by the passage. Pictures make written instructions unnecessary is not supported by the passage, and long paragraphs are best for patient teaching is not supported by the passage. Question 25. Through careful reading of a mean score stem, which increase is shown from Monday 18 to Wednesday 26 in a simple practice chart. Option A 8, Option B 5, Option C 26, Option D 44. The correct answer is option. The increase is the final value minus the starting value, 2618 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference.